this afternoon, my TV. I need to have Sandy get us some more of these.
Yeah.
And a new big card. There's a big card. You know how they used to be little cards?
Mm-hmm.
They are full-size
Yeah, you told me
sheets.
about that. I'd like to carry one of those around in case I get a after-hours phone call. I don't get too many of those with TVs.
Okay, it's 10:30. I want to welcome everybody to the mayor's every other week press conference during this pandemic of COVID. I'm Kurt Carlson, President and CEO of Bowen Center. The mayor is in Indianapolis representing Warsaw in meetings, so he asked me to sort of moderate the meeting today. So he's on, so is Commissioner Groninger. But here at this table, we have Dr. Remington and Teresa Reed from the Health Department. And Teresa, maybe we can turn it over to you and ask what's the updates?
Good morning. Well, like everyone, we're watching to see if we've got a little bit of an uptick and where it's going to go from here. And so if we look at the whole graph of all the time that we've been through this, last year when it started out small and then when it went pretty high during November. And then I'm also going to bring our attention to this spike that happened right after Christmas. And I'm going to ask Kosciuszko County as we come from into this spring break and from this spring break, I want everybody to do the same thing they did then. If you're sick, I want you to get tested and stay home. And if you don't go anywhere and you get sick, please stay home. Don't keep going. Don't trust that it's allergies if you're not sure. Please just be very sure. That's what I'm hearing a lot from people is that they said, I just had a cold or I thought it was my allergies. And then they are going ahead and going to work. And I don't want to see that because that's one of the ways that cases could really increase in a hurry. As we look forward with the changes that are going to be happening with masking, I'm going to say what my plan is for that because nobody exactly has a perfect knowledge of how this is going to work out or what's going to work. So what I'm going to do in our county is I'm going to watch whether or not we have significant changes and how those changes stack up against counties that are more rigorous in a mask mandate or less compelling in the mask mandate, and just make sure that we're staying, that we know what's happening and that we know how to react to that if we have anything change. So that would be my part.
Mm-hmm. Okay, Dr. Remington.
Sure.
Please.
Yeah, well, thanks again for asking the Health Department to be here this morning. It's our privilege, really, it is, to serve this county. Just a little perspective. Thanks, Teresa, for giving us the main points here. I wanted to reflect back on this last year. March 26th, a year ago, was our first confirmed Kosciuszko County COVID case. So we're now 8,826 cases later, a jump of 167 in the last 2 weeks since we've met in this venue. We've had 112 dear people pass, and condolences to those families and loved ones. We have had no new deaths since the last time we met. With Kurt Carlson's Bowen testing site and other testing sites, 99,600 some tests have been administered to Kosciuszko County residents in the last year. 100,000 tests. Gee whiz. 5,300 in the last 2 weeks. So a little bit of a surprise this week. We slipped a little back in the epidemiology. We had been in a blue advisory. If you look at the state's COVID dashboard, it'll be announced here in just an hour or two publicly, but we will slip backwards from blue to yellow, so a little less favorable. And it's because our positivity and new cases per week went up a bit. Let me give you those numbers. Our 7-day rolling positivity is now 4.3%. To give you context, 2 weeks ago it was 2%. And if you look at November at our worst, 26%. So a little bump up, but nowhere near where we were in November. And the same with the new cases on a 7-day rolling average, 27 a week or 2 weeks ago, 134 in November. So a jump from 7 to 20, but nowhere near 134. So we are seeing a little taste of what's been making news. I'm sure that most of you have heard. There are some regional surges. The state of Michigan has been very notable. I think that's Metro Detroit primarily, but it's not just Metro Detroit. And nobody is exactly sure why this surge is occurring. To use the term multifactorial is probably the most honest. It has something to do with these new variants. They're more contagious. Maybe some pandemic fatigue, right? We're all there. Maybe. It's travel season, some spring break. So the mixing pot is stirring up a little more aggressively. As Teresa mentioned, perhaps, reflecting back to the holidays. So there's a variety of things. We're not sure in public health where exactly this is going. The optimist in me would say, I can't imagine this curve that Teresa showed us just a few minutes ago will move in the direction as aggressively as what we saw in October and November. I just can't imagine. If we think of a forest fire, I cannot imagine there's enough tinder on the forest floor anymore to allow that to happen. But none of us really know. So just as Teresa said, I don't think it's time to let our guard down with all these nasty public mitigation things we've been yapping about for the last year. I know that the semantics will change here on April 6th, right? We'll go from mask mandate to mask advisory. But I'm asking you to go past the semantics, those caring individuals that might be listening or reading later, and to just keep doing this for a while longer. I don't know how long that is, but if we could just have another 6 or 8 weeks, I think we'd understand a little bit more where the epi curve will be going on these new variants. I don't think that'll be crushing to us as individuals to do this another 6 or 8 weeks. We've been doing it for a year. So those of you in charge of indoor spaces where people congregate, I'd ask that you continue to consider having a sign on the door encouraging masks. I think social distancing has its place, and thinking about indoor congregate population sizing is worth thinking about and mitigating if you can. It's getting nice outdoors. We can do more stuff outdoors. That's good. We can separate out. It's not as contagious. I think it's been shown to be true with this pathogen, much less contagious in outdoor venues. So that's good. So it's really a race. You've heard that metaphor, and I think it's true. It's a race, the vaccine versus whatever these variants are going to do in the population. It is a real opportunity to be immunized. And I'm glad they're opening up pretty quickly in succession now to 16 and older today in the state of Indiana. Great. And don't be too concerned about which product you seek, really. Take any of them. I would, and I'm immersed in the literature with these vaccines. I'd take any of them offered to me. You can go online, it's rshot.in.gov, or you can call 211 and just say, I'd like to be immunized against COVID, and they'll set you up. Or you can set yourself up online. You can look at the site you want to go to, look at the timetable that works for you, and just schedule vaccine. It's all scheduled. We may see some walk-up clinics emerging in the weeks ahead, but mostly it's still scheduled in the state of Indiana, which I think is a good strategy. So please be immunized. It works. It is an amazing, modern take on a pandemic come to us. Take advantage of it, please. Starting to hear frightened patient stories in my clinical practice just in the last 10 days. I hadn't heard any for a few weeks after the late 2020 surge. Lost a lot of patients in my practice during that time, but I'm starting to hear frightened stories, wide-eyed people saying, "Doc, I'm not better, it's week 2, what's going on here?" And I hadn't heard that for a while, so please respect this pathogen. It isn't quite done with us yet, but we're so much better than we were a year ago, and I'm extremely thankful for that. We have a wonderful community. People care about each other. I will wear a mask when indoors in congregate settings. I'll go to a restaurant. I'll take my mask down to eat. But still be wary. Those of you immunized, even though you still do these things, I'm immunized, I'm still going to do these things, we could really quibble whether we really actually have to, because honestly, these vaccines work really well. It's very unlikely post-vaccine you're going to get an infection, at least a serious one, and it's probably very unlikely that honestly you're going to shed something to somebody else. But nonetheless, be a good citizen, a good neighbor, be gracious. Let's hunker down and be arm in arm for a few more weeks. And I don't care what we call it, mandate or advisory, please just be vigilant a bit longer. Thank you.
Thank you, Dr. Remington. As I was sharing with Teresa earlier, we've seen a dramatic increase in the number of people coming to the test site to get tested. Speculation is people were traveling and they wanted to get tested before they traveled. Could be that, could be, an increased number of people feeling symptoms. I can't sort that out by the data I have, but I'll start asking my test site people, what's your opinion? Does this seem like it's people ahead of travel or are they sick? So that's just something of note. Schools, we're doing the testing for all the school systems in Kosciuszko County, Warsaw being the highest number of referrals that we get. And so far, I'm not seeing a high positivity rate, but that could be because we've only started testing for the schools recently, but we will be tracking that. Again, we have the hotline for persons who have language or computer challenges. Please call it. We've also seen a dramatic increase in the use of the hotline, and that phone number again is 574-347-4256. And again, we've seen an increase not only in the number of calls, but the number of people who, instead of asking questions, they actually are calling to get registered. Earlier on, it was maybe 50-50. Now it's almost all the people who call to be registered, and a high number of Spanish speakers, because again, the state website is only in English, and so they'd have no access to the vaccine if we didn't help them with that. So it's a privilege to do that service. And one of the things I might add is Bowen Center is a member of the Hospital Association because we run a hospital. And I saw earlier this week their policy position is, even though the governor is going from a mandate to an advisory, they're recommending, out of an abundance of caution, that all hospitals continue to have masking and social distancing. And we will do that. Bowen Center will continue to do that also in correspondence with that. Like Dr. Remington mentioned, I also wear a mask. And I catch myself sometime. I walked into a facility and realized I was not wearing a mask. It was in my pocket. I just hadn't put it on yet, so I quickly had to scramble around and get it on. So I'm trying to be very conscientious about that. One of the things that I observed in a business retail facility this past week was a fellow who the store apparently had a hard and fast rule that they were not going to serve somebody who was not wearing a mask. I was in the line just one over from that. It was clear this person was ex-military, had an actual weapon on his hip, and it was a confrontation. And given the mass shootings we've heard about recently, my immediate concern is I was overhearing the argument, the swearing, and all that, because the person refused to wear a mask, supposedly had been gassed in Afghanistan and had a reason to. I worried that that was going to become an incident out of control. And I was thinking, am I going to have to dive for the floor to avoid getting shot? And so we've talked about that within Bowen Center. We're not going to go to that extreme. We can encourage people to wear masks. We're not going to be calling the police. We're not going to wrestle them to the ground. We're not going to refuse to service them because we're here to serve. But we want to encourage people as strongly as we can. So, that's kind of the line for me. Getting into a fight over wearing a mask or not is not what we should be doing. It's just common sense. And I don't know if either of you have heard of any kind of that's the first time I'd seen an altercation. Teresa, you got something?
I've just seen, I've seen a lot of confrontations, and I agree, it's harsh. I wish we all would be a little kinder to one another right now.
So we have Commissioner Groninger and the mayor. Commissioner, did you have anything? I assume you're still on.
Yeah, I'm still here. No, I really don't have a whole lot new. As this thing moves forward, we're going to continue to lean heavily on our health department and their recommendations, as well as the governor on what we're going to be doing, or what the mask mandate's going to be if they continue with the dropping down the advisory level here shortly. I know that we're all kind of weary and getting tired of all this, but I guess I'd encourage everybody to keep up what we've been doing to help keep this at bay so we can get back to normal life here soon, hopefully.
Yeah, thank you. Mayor, I believe you're still on. You're representing us an important business in Indianapolis. Do you have any comments?
Well, first of all, I'll correct you, Kurt. I'm not in Indianapolis. Let's just say I'm on sabbatical for a few days.
Okay.
I'll leave it at that. But thank you for hosting, and I know this was a very important week with the upcoming restrictions being somewhat softened. And I want to start with a little bit of what I would consider good news. There was just a Wall Street Journal report this morning that the U.S. Census Bureau, in conjunction with CDC, had done some polling of folks regarding their willingness to get a vaccine. And the good news is that the hesitancy to receive the vaccine does seem to be on the decline. 80,000 people were tested during sometime in the middle of March. So I don't know, I saw who did the study. I don't know all the details, but I think you could reference that. But I thought that was good news. And that just really leads me into the importance and the good job that the county is doing with our vaccination sites. We got a few things bubbling to try and increase that, but we certainly have to just wait on our allocations to increase. And I did get on the R-Shot site this morning, and I had a 6-minute wait just to kind of see where we were at. We've got appointments available next Wednesday locally, and again, I assume with the increase in or the increased accessibility that there will be more demand. And again, we've done a great job keeping up with our allocations, and we'll just continue to work with the county and the health department to make sure that we're able to meet the demand and with the ample supply as it becomes available. With regard to the restrictions on April 6th, being to more recommendations, the city will continue our restrictions within City Hall at least for a few weeks, maybe towards the end of April. We're going to kind of take Teresa's approach and just keep an eye on things. I noted things ticking up a little, going from blue to yellow, and all the things Dr. Remington talked about. We're just not completely out of the woods. Obviously, our meetings will continue to be live. City Hall is open for business. Social distancing, if someone comes in for a meeting and they're able to social distance, you can pull the mask to the side with a lot of the barriers we have up and our distances. But the important thing is we are going to continue our restrictions probably at least through the end of April. But again, I don't want to put a time on it because I'm hoping that these numbers come in our favor. But again, that's just for city buildings. I'm in complete agreement with the health department that has been spoken this morning that the governor has followed his recommendations up to this point, and I think it's prudent to continue that. So, all good. I think, at the end, we're just trying to avoid another spike. The state is still under a public health emergency, so I think we're kind of in a little bit of a limbo now. I feel great that we're heading the right way, and just continue to hope that everybody gets out and gets their vaccinations. Let's put an end to this thing. So again, Kurt, thank you for hosting, and thank you all for your attendance. Again, this is I think an important day, just trying to figure out where we are on the continuum of this thing.
Dr.
So
Running,
thank you.
would you remind us how many vaccinations you folks are doing of K21?
Yes, I didn't get into all that, but very proud of our immunization clinic staff, Jeannie, and all the volunteers and staff that she's put together. 20-some people come together on Mondays, Tuesdays, Wednesdays, and Thursdays to provide around 400 doses each of those days at our K21 Pavilion clinic site. There are other places you can go get vaccine too, but we think we're doing a pretty good job. And like the mayor said, I was online this morning and could get an appointment if I needed one next week at that clinic to get vaccine. I didn't think that was too bad of a queue. But we're allocated 1,600 doses of the Moderna vaccine weekly, and we're just about giving all those doses every week. A little trailing off, I guess, the last couple vaccine clinic days, but we'll see where that's going. We do have some J&J vaccine, trying to get a little bit more for a special day clinic event in the next month. And we're in negotiation with the State Department of Health as to how that exactly will look. Let me give you some data. You can find this on the COVID dashboard at the state site too. But in this county, we've gone up 3,500 new doses in the last 2 weeks to now 15,700 some people in this county have had at least one dose of something. And it didn't have to be in our clinic. We haven't personally given 15,000 doses in our clinic. I bet we've done 12 or 13,000 of those. But anyways, of our Kalsanoska County residents, 15,800 have had at least one dose. That's 19.8% of those 16 and older in our county. And here's a better number yet, 9,865 are fully immunized, and that's up 2,370 from 2 weeks ago. 12.4%. We'd like to see that number go up. That's a little lowish. I can't wait till that number pops up. If we can pull off, some special, at least one special clinic with the J&J single-dose vaccine, that'll help get that number up a little quicker. Those counties that have had access to those large point of dispensing clinics with the single-dose option, that number goes up very quickly for them, right? That percentage of their population fully immunized is a great thing to see improve. So we have lots of vaccine. Wish we had more. I don't know if we could personally give more. I think we're probably capped out with the model we're using. But we've been in conversation with the mayor quite a bit and other clinical partners to possibly expand if it needs to come out of our allocation, should that grow. Pharmacies, I think, are stepping up stronger. I noticed that just looking at access to appointment slots, so that's good. I think, the state's talking about more special events, pop-up clinics, like what were mentioned already this morning. They're doing something with large corporations to where on-site, I believe, usually through a clinical vendor of some type, these vaccines will be offered on-site at large employers. I think that's a great strategy. I don't know if that'll come to our community or not. I think look for any venue you can get a vaccine. It doesn't have to be our health department. I'm proud of what we've been doing. But it doesn't have to be at a health department. I can't wait for all these other venues to get more and more prominent in the vaccine delivery, so it takes a little pressure off of us, quite honestly. Kudos to our volunteers. We could not do it without them. And those of you who have means, bring them lunch someday. That would encourage them. About 22, 25 of them in there, Monday, Tuesday, Wednesday, and Thursday. We're still doing early childhood immunization on Friday. We don't let that slip behind. That's been a national discussion point. Some of that is. I don't want to see that happen in this county. We don't want pertussis. We don't want measles. So it's important to get those shots in arms too. So, yeah, great topic. Vaccine is a big deal for our health department. It is year by year, but it's really a big deal right now. I'm glad we can be there. So, thanks.
Maybe we can open it up to any questions from the media.
Yeah.
Good evening. Dr. Carlson, can you tell us, you mentioned the number of tests are up. Do you have any figures on that?
Yes, we'd gotten down to an average of 28, 30 a day. We're up now almost 50 a day, so it's almost doubled. And that's just been in the last couple of weeks. And same thing, the call volume is up to the hotline.
And just to clarify for the city and county, no changes in policy going forward for the short term?
My understanding is those will be discussed at the county level next week. And I think the mayor's already stated what he wants for the city buildings. So, and for Bowen Center, no, there will be no change for Bowen Center. It's masks and distancing and all that.
And for the medical professionals here, I'm wondering how perplexing after 1 year is it that we've made these great strides and then suddenly there's concern about a third wave and you've got all this fatigue.
Yeah. Well, it's a disappointment, but just knowing a little bit of the history of pandemics, not totally surprising. And, these things come in waves. I'd like to think the largest wave is in the rearview mirror. And virus genomically shift around. Influenza is famous for that. Coronavirus is showing it can do that too. So it just, all mixes adds some unpredictability a bit. So it's a little, it's disappointing, but I don't think it's dire, personally.
Thank you.
Mm-hmm.
Okay, I have a question. With spring break, I know you talked about spring break and encourage people to stay in, but I mean, really, that's probably not going to happen. People are going to travel.
Well, actually, I only encouraged them to stay in if they were sick.
Okay, so people can travel, but then are you worried about when they come back, and these kids go back to school, you're doing the testing for the schools, we're expecting a spike, or what kind of a concern is that?
I would expect that we're going to see some part of a curve go up, and that's why I really hope that people will take that extra time, especially if they know they're at a little higher risk, and they'll be responsible and make sure that they're not sick. That's my big thing. Please, 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 don't go to work sick. Don't send your kids to school sick. I get a lot of calls right now over travel testing, a lot of calls on it, and that's a complexity of their own. If anyone has travel plans, make sure you're very careful on what you're setting up to do that. There's a lot of details, and everybody's criteria are different.
When people return, let's say I go to Florida for a week, I'm not let's say when I come back and I have a child who's in kindergarten, would you recommend people get tested before they go back to work in school if they went to, say, Florida for a week?
If they call me and they ask me that, I'm probably going to talk to them about getting tested and the timing that they should do that in.
You would encourage that before going back into school, back into work?
Right, and I might not, the kindergartner wouldn't be my first person to test. I would first be most interested in the adults, and definitely if anybody had symptoms.
But maybe not test if they had been immunized
Yes.
or had had a natural COVID infection for sure.
For sure.
Earlier in the pandemic. Then you don't, because what are you going to do with that information? And you still have the potential for a false positive test. No test is perfect.
And so now Pfizer's saying that what their vaccine is 100% effective in kids, what, 7 to 12?
How can they have that?
But is that what they're saying?
I don't personally know
I
that.
don't know what they're saying.
I haven't heard that.
They haven't had time to, they don't have time to have that
You
number.
scoop me. I'm sorry. I don't know.
That was a small sample, I think 2,500, and
Okay.
I heard that report this morning. It was
Okay,
a small
and so,
sample.
as the kids are important to reach this herd immunity, I mean, is that really important to get these children vaccinated once these vaccines roll out to younger than 16?
Kids weren't one of the populations that had a lot of severe illness. I really can't recall a single child in the county that I know of that had, there were some kids that had some fatigue for a while, but I think all that I know of have recovered. So, no, and they don't transmit it as heavily.
Yeah.
So it's not a big concern. It's not one of the populations I'm worried about. I really want to get the vaccine into the people who are at high risk for bad outcomes, especially if they haven't had a natural case and they don't have any natural immunity. These are the people that, to me, makes the most sense to target.
Right, I understand that. So, but my question, I guess, is once these vaccines become available to these younger ages, right? Is that the key to really reaching that herd immunity?
I mean, I may not perfectly know, but one of the confident take-homes so far in this pandemic is, and people have really looked at this, amazingly, these kids, the young school kids particularly, don't seem to be an incubator for this pathogen. I mean, that was really felt to be odd. Nobody trusted that because influenza is different than that. Influenza is famous for being incubated in schools, you know? But the coronavirus that we've had a pandemic with for the last year doesn't seem to do that, oddly. So I personally, even though I would embrace immunizing as many as possible, I'm a big vaccine guy, I'm not sure that unlocks the secret to this pandemic as far as public security. I think we've done great good in immunizing the most vulnerable from infections, just from a case-specific risk. Right now, what I have understood in the Michigan experience is that the growing demographic showing infection is what we had seen back around the holidays are the 20-somethings, the younger facets of the population. They're the mixing bowl. So college kids coming back from spring break probably will be a mixing bowl to some degree, and probably many of those haven't been immunized yet. So possibly getting at the 20 and 30-somethings, and getting great immunization rates with them eventually, yes, maybe that really will unlock a different door into success with this pandemic. But not necessarily the youngest kids, in my opinion.
Any other questions? I'm seeing heads shaking no, so again, Mayor, you want to say any closing remarks before we wrap this up? Oh, you're muted. You're muted. There you go.
Welcome everybody back again in 2 weeks, and again, just like everyone else, the vaccinations really seem to have gotten us to the point where we're on the cusp of getting through this and getting over this, and we just all need to take advantage and get that done. There's going to be more opportunities for vaccinations, and again, I think we're doing a great job here in the county. Let's just hang in there for a little bit longer. Thank you.
Right. Okay, thank you.
Thank you. Thanks, Teresa. That was great. Thank you. Thanks for the article, too.
Hey, Doc, are they breaking down the immunizations by age? So you mentioned the 20 to 30 range. Do we have any count on how we're doing getting them vaccinated?
I don't.